Good morning, everyone. Welcome to Washington State University's 17th COVID-19 Town Hall meeting. I don't know about you, but I did not expect that we were going to be doing 17 of these. My name is Phil Weiler. I'm Vice President for Marketing and Communications, and I want to thank you for joining us on this wintry day. I'm looking at the list. We have well over 1,200 folks who are already joining us, so thank you for doing that. I know that this is a challenging travel day for folks across the state. We have suspended operations on both our Tri-Cities and Spokane campuses today due to snow, and our colleagues on the west side are expecting an inch or more of rain with the possibility of localized flooding. So if there are any students out there who are planning to travel from the west side to our campuses over on the east side over the next several days, really please make sure you make a plan for how you're going to get to your particular campus. Keep a close eye on the weather report, check to make sure that the road conditions are passable and that the mountain passes are even open, because as of this morning, all the passes were closed. Make sure your vehicle is ready for winter travel. Make sure you have warm clothes, food and water. And I think most importantly, allow yourself plenty of extra time to get to your location. This will not be a routine trip over the mountains if you've made that trip before. So you really do need to have a plan in place. The other thing I think need to acknowledge before we get started is what today's date is. Today is January 6th. It's the 1-year anniversary of a violent attack on our US Capitol. And while that isn't the reason that we're here today, I do think that we need to acknowledge and recognize that this was a dark day in America's history 1 year ago today. But the reason we are here today is to talk about what WSU's plans are for spring semester. We will be returning to in-person instruction next week, just as we did for our fall semester. Important to note, our vaccination rates, as I think many of you know, are north of 90% for all students, faculty, and staff across all of our campuses in the state. That is fantastic news. Those high levels of vaccination are allowing us to be able to return to an in-person experience for our students. We also know that many of our members of the Cougar community have been boosted. We conducted a booster clinic on the Pullman campus just before the end of the semester and had close to 1,000 people who had signed up for that. If you have not received your booster yet, please do so as soon as you are able. It's really critical, particularly with the Omicron variant out there, that we get as many people boosted as possible. Other thing to remember is we will continue to be following the public health guidelines that the Centers for Disease Control and the State Department of Health have in place for us. We'll talk more about that in just a few minutes. And then finally, I think as many of you know, Washington State University's Emergency Health, or EH&S, Environmental Health and Safety Unit has been in close contact at the state level with public health officials to really make sure we know what's happening in each community where WSU has a campus. So again, we'll talk a little bit more about that in a moment, but let me start by introducing our panelists and then we can dive in. We're joined by President Kirk Schultz, by Provost and Pullman Chancellor Elizabeth Chilton, Sunday Henry, Physician and Medical Director for Cougar Health Services on the Pullman campus. We'll be talking more about those public health precautions. Bill Davis, Interim Vice Provost for Academic Engagement and Student Achievement, is joining us from the warm climes of his vacation. So thank you, Bill, for joining us while you are on break. Bill's going to talk a little bit about instructional guidelines for the semester. If for some reason he does lose his internet connectivity, we have Craig Parks, who's our Vice Provost for System Innovation and Policy, who's going to fill in the gap for us. And then finally, we have Laura Greiner Hill, who is our Senior Vice Provost. Laura's going to talk to us about some modified duty options for faculty this spring. But let me turn it over to President Schultz and we can go ahead and get started.
Great, Phil, and thank you and welcome everybody who's joining us. Let me just sort of start off my comments just with a shout out to all of our staff on all of our campuses who are working hard to have our campuses ready for classes on Monday. I'm coming to you from my office here on the Pullman campus. And I know early this morning, we had staff members out clearing snow, trying to clear parking lots and things like that. So when I was fast asleep, we had a whole set of folks across all of our campuses really working hard. And I just want to thank those staff members for being outside and working so hard while it's been snowing. I also, Phil introduced Elizabeth, but I also want to take this chance to really remind everybody that Elizabeth started as our first ever chancellor of the WSU Pullman campus on January 1st. So really thrilled to have Elizabeth as part of our leadership team. She's been with us now for over 18 months. And we just looking forward to her leadership on our flagship campus and really kind of mapping out what the future of the WSU Pullman campus looks like, while I'll be spending more of my time around the state and our campuses, extension sites, and so on, really working on partnerships and moving WSU forward as a system. We are very excited to return to in-person instruction and experiences. And I do realize that for some groups, they say, man, this is great. For some people, there are a lot of angst out there about being in person for various reasons. I was at a local restaurant last night here in Pullman. At the end of our meal, our server came and said, hey, I know the town hall's tomorrow. Can you just give me sort of the abbreviated version? And I said, well, we want to make sure that we're doing everything to keep faculty, staff, and students safe, but our plans are for an in-person experience. And she said, thank you. That's really important to me. That's really important to us in a community. So it's interesting as we think about mental and physical well-being. Some people can say, hey, it's really tough on me being in an in-person environment, teaching, working with our students. I have other folks that will say, you know what, my physical and mental well-being is better being in person because I just don't want to be stuck behind a screen and doing Zoom again for a semester. So I just want to acknowledge up front that no matter what decision we make as a WSU leadership team in the state of Washington, that there's always going to be somebody that goes, that's not going to work for me. And you're going to hear from my colleagues today. We really want to help you to make sure that you feel safe, that you're supported, and that you have everything you need for a successful semester. I want to remind everybody, and we've talked about this over the last couple of years, of not coming into work or attending class if you're sick. I'm of a generation that, boy, if you could stand up, you needed to be at work. If you could, even if you're hacking and stuff like that, it's like, man, I'm going to come to class. We're going to ask you not to do that. If you're not feeling well, whether it's flu, you woke up with a bad cold, it doesn't matter. We're asking people to make sure that you stay at home under those kind of circumstances. Omicron is presenting, it's a lot more mild symptoms than previous variants in vaccinated individuals. But we also want to ask you all as instructors who are here, supervisors, people who work at WSU, to just be understanding, be a little lenient, and make sure that our goal here is to make it all the way through the end of the semester in a safe manner. So a little leniency is going to make a big difference here. Students, talk to your instructors, make sure that you keep those communication lines open. Don't just not show up to something and go, yeah, I wasn't feeling well. And the president said that you would be lenient. Keep that communication open, but please, if you're not feeling well, stay at home, don't come into work. Phil mentioned earlier about boosters and vaccination rates, and I'm really proud of the incredibly high vaccination rates across all of our campuses. But we want to remind everybody to please, if you have not already done so, to get your booster. It's really the only way to protect ourselves and our fellow Cougs. Noel and I got our booster shots a couple months ago. As soon as we were eligible, we were right in line. We got one at a Walmart in Spokane that happened to have appointments available when we were traveling. So please, if you have not gotten your booster and you say, hey, I'm feeling pretty good, doesn't matter. Take that opportunity to get the booster in your community prior to coming back onto school if you haven't done so already. Finally, as I finish off my comments, after 2 years of the pandemic, as Phil mentioned, we didn't expect to be doing another one of these videos. We thought, hey, we're kind of over it. Many of you, when we saw that curve start to go down on our case counts for the pandemic a month or two ago, I thought, okay, maybe we're finally in the clear. And then Omicron rears its ugly head. It's important that you practice self-care. And there's some ways that I think are important for all of our employees to really think about it. And I'm really talking to our faculty and staff right now. There's ways that you need to disconnect from work. One of the things that we heard from many of our employees is, hey, Workday has brought some great things to campus, but it's also brought a lot of stress. Things don't work the way they used to. And so what we wind up doing is delaying some implementation on some aspects of Workday to support our staff members that we're doing day-to-day work on this, saying, hey, let's stop adding new stuff and let us get the stuff that we need to be doing down and make sure everything's working properly. So we responded, hey, we're excited about this new stuff. We said, hey, at some point, you just got to also relax some of our own standards we set for ourselves to say, let's extend this out a little bit. We're going to be engaging in leadership across campuses over the next few weeks on trying to establish some no meeting days for their units and areas, supporting our employees taking time off and away from work. And one of the things I found is during the COVID, if I opened up my work email on a Saturday, I might get one email note that was really work related. I have lots of listservs and all that. Or on a Saturday. And then what happened is as things started getting a little better, I found that frequency was starting to come back up again. Ask yourself, do you need to send that email at 9:00 at night to somebody? Is it really that important, or can you wait till the next morning? Do you have to be sending a bunch of notes on Teams and other kinds of things on a Saturday, or can that wait a little bit? We're going to be talking about some of these things, but there's a lot of habits that we all have built in. We have a lot of A-type personality, men and women that work across our campuses. And it's just, you say, hey, I need to connect with somebody right now. Ask yourself, do I need to do that now, or can it wait? And I think most of the time I find with my responsibilities, a lot of that can wait. It's not that urgent. And it's not just me, it's the receptor that's getting it as well. So we're going to be talking more about this. I think it's important as we start the semester that we start it in a positive place, that we start it working to have a safe work environment, and that you all, as WSU faculty, staff, and students, feel that leadership is listening to you, is supporting you, and making sure that you have all the tools you need to have a successful spring semester. So, Phil, I appreciate the opportunity to say a few things. I look forward to hearing from my colleagues. And as always, go Cougs.
Thank you, President Schultz. I appreciate that. I'd like to turn to Dr. Sunday Henry, if I could. Dr. Henry, I would love to have you, I guess, remind us about the public health precautions that we're going to need to take as we are in person. I think that we have been doing this now for close to 2 years, and I am concerned sometimes that people might get a little lax and not really think about the fact that we need to have these masks handy. We need to have making sure we're washing hands, keeping those physical distances when we can. So if you could just share with us from a public health perspective, what kinds of things need to be top of mind as we return to the classroom on Monday?
Thank you so much, Phil. It's delightful to be here this morning, and I really appreciate President Schultz's remarks about all of us preparing and being ready for a successful semester in person. And really, I think one of the themes of the things that I'm going to hit on is just the constant changing of the guidance due to the constant changing of the virus. And I really want to reassure everyone listening out there, faculty, parents, and students, that we as a system are really working together as a group to be on top of that guidance and then digest the guidance and apply it to this university system in a way that makes the most sense for everyone involved. And there was a flurry of activity that occurred between the Christmas holiday and the New Year holiday. And many of us worked together to just sort of start digesting that and be ready for everyone to return. And there wasn't really any change in a booster recommendation, but the CDC came out with new guidance on isolation and quarantine that really sort of categorized all of us in different areas depending on what our vaccination status. And so for right now, and this has already been said, I do want to echo one more time, at least one more time, it's really important to get your booster. WSU is not requiring it at this time, but there's a possibility, and we will continue to consider that and let you all know when and if that changes. But despite that lack of requirement right now, it really is the best thing for our entire university community to be boosted. And along those lines, the CDC has sort of hinted that being boosted might be the new fully vaccinated status. But I will say they hinted at it. And I know there's just all kinds of, things out there in the news, kind of frustrated at the CDC and all that sort of stuff. Whatever, we'll roll with it. But it does definitely look like that, if you're boosted, what we know is that Omicron doesn't like you nearly as much as if you're boosted, and the CDC is reflected in their guidance. So I just want to say it's evolving for sure. And I'm not going to go. I actually, before this, I called one of my colleagues and I said, hey, and I provided a bunch of details, and we decided all those details were kind of confusing. And that's because it's confusing out there. And so I'm not going to throw out all those details. Just know it's evolving. We are here to help you wade through those details. And there's a very short media document that the CDC sent out on the 27th that we are going by. The Department of Health, the state of Washington Department of Health, endorsed that on the 28th. But that little document seems to imply that being boosted is going to be the new fully vaccinated, but they didn't come out and say it. But I do want to say we on the Pullman campus will be holding vaccination booster clinics. And also if it's the first time that you're getting a primary vaccination, if you're a new student or that, we are holding vaccination clinics every Friday this month, including tomorrow. You can still sign up. So please know that we'll have that opportunity on the Pullman campus, but there are also lots of opportunities across the state. And so for all other campuses or wherever you are right now, if you decide you want to get boosted in the next couple of days, which I highly recommend, then please visit vaccines.gov and look for your opportunity. And right now, I'm not hearing anything about getting a vaccine being an issue. Also along kind of the, I'll just say sort of messiness of being in a pandemic, new guidance on mixing and matching those vaccines. And just know that your vaccine provider can answer your individual questions on that. And that we went from being pretty strict, you had a Pfizer, you need a Pfizer, don't mix and match. That's absolutely out the window right now. So we are here to help you wade through that as well. I will go through just a little bit of the new guidance, just because it's actually really good news. So if you test positive, regardless of your vaccination status, if you're boosted or unvaccinated or anywhere in between, you stay home for 5 days. And then the good news is, and this is where the CDC is getting a little bit of pushback, is they didn't really outline this very well. But if you're better and you're not having fever for 24 hours, then you can come out of isolation with your mask. You need to be really good about masking. But that's really good news because before it was longer than that, it was twice as long. And I think that this is also a sign, and this is my interpretation, not the CDC saying, but it's a sign that the pandemic is evolving, our immunity as a world is evolving, that we no longer need to be in isolation so long. And so that's a really good thing for our mental health and our ability to go ahead and live our lives. And then, so the second piece of it is if you were exposed to someone to COVID-19, and this is when you would previously have quarantined, there's no longer, hey, I need to quarantine for 14 days. If you've been boosted, if you've completed a primary series of Pfizer or Moderna, if you've completed a primary series of J&J, sorry, I'm going to go back. If you completed the primary series of Pfizer and Moderna and you're within the 5 to 6 month mark, and I'm fudging there a little bit because there was new guidance that came out yesterday about Pfizer and boosters. If you are boosted, have your primary J&J and it's been within the last 2 months, then you get to not isolate at home. You get to wear a mask religiously. And then if you can, test on day 5 if you have testing available. Now, if you have any symptoms, you need to you need to reassess, stay home, and then for sure get a test. This is for asymptomatic. So then the last piece of that is if you're over 5 to 6 months of your Pfizer, and I'll just be fudgy there on that because we really need to dive into that. If 6 months of the Moderna, or after 2 months of the J&J, or and you're not boosted and you're unvaccinated, then you need to stay home for 5 days and continue to wear a mask. And this is all if you're asymptomatic. That's a lot of details. Let us help you wade through that. But the main thing is that those definitions, the 10-day if you had it, the 14-day if you were exposed, have now been adjusted, and that's very appropriate. And it seems new and hard, but we will definitely continue to message it, have the right information on our websites. We've already been working with EH&S and all of our partners to make sure that we're consistently applying this across the campuses. This has already been said, I'm gonna go ahead and say it again. If you're ill, stay at home, and then wear a high quality mask. And we're looking, I loved that Phil showed us our mask. Any good doctor, I think, has any sort of various masks laying on the desk here, but really a gaiter, a bandana, or one of those thinner cloth masks are really not doing the job right now. And so really a higher quality mask is like a medical mask with the layers and the metal piece in it and things like that. And you don't want gaping around your face. So if you have a mask like this that doesn't fit very well, you can put a cloth mask over the front, or if you can get your hands on a KN95, that would be fantastic. We're working to have some masks around the system in high traffic areas, and we really want to encourage people to wear a higher quality mask in those areas. And we're working on that behind the scenes for the system. And then your COVID unit coordinator could also be a resource for you. And as I wrap up here, I do just want to acknowledge, and I will say, this is just going to be messy, but we're okay. We'll work through this messiness. It's been messy before. We have good mitigation measures. We know that the vaccines continue to provide us with good protection. It's going to be messy for a little bit. The case rates are just kind of, the graphs are straight up everywhere. But I want to reassure folks that we are ready to handle this as a nation and as a university. But it's going to be a little bit messy. But we will all be okay. And as long as we continue to work with each other, we really do want to encourage supervisors to report positive cases to the WSU EH&S staff, partly because not all testing now is done in a laboratory that has to report that to public health. So we just kind of want to continue to communicate with each other so we have a good sense of our case rate. I'm going to close with that. Take good care of yourselves and know that we're going to be okay. It's going to be messy for a little bit, but we're absolutely going to be okay. Thanks for having me today.
Thanks, Sunday. You mentioned the fact that infection rates, case rates are increasing. What about hospitalizations? I know there's been a lot of discussion about the fact that those two numbers aren't tracking the same as they had in some of the previous spikes. What does that mean for us, and what is WSU going to do in response to that difference in case rates versus hospitalization?
Thank you for bringing that up. We've been watching this really carefully, and I think this is reflected in the CDC guidance as well, is that we are currently not seeing folks be as ill with Omicron. It's definitely very contagious, and we're not seeing the high hospitalization rates, and then we're carefully monitoring the death rates. And so, WSU as a system will continue to monitor those case rates in their respective campuses area, work with their hospitals and communicate with everyone, and work together to make sure that we're all in our respective areas making good decisions, as we know that we are a part of the communities where all of our campuses reside. So that is good news. And if you hear that optimism in my voice, that is sort of as the pandemic is evolving, this is the kind of thing that can happen. And we will also continue to keep our eye on the next thing that might happen. I think we all continued, as President Schultz alluded to at the beginning, that we are all hoping at some point this is over. But if it's not over, we will continue to make sure that we're prepared and working with the folks in our communities to make sure that we're ready.
Great, thanks for that clarification. I do want to emphasize one thing that Dr. Henry mentioned. If you have not been boosted, or if you have not received your first rounds of vaccinations yet, go to vaccines.gov. That's vaccines plural.gov. If you've visited that website, you see it's a really quick and easy way to find in your local community where you can get the vaccine or where you can get boosted. You simply put in your zip code and it'll tell you all the different locations. And right now there are a lot of locations across the state that are available. And again, it's worth repeating, these are free vaccines. And so it is simple, easy, quick to get vaccinated and to get boosted. So please do be sure that you do that. The other thing I'll reemphasize, I guess, is, as Dr. Henry mentioned, we're asking supervisors to please do contact environmental health and safety staff. If you have a employee who is reporting that he or she is ill from COVID, we want to have a good sense of what percentage of our workforce is being impacted and what the rate looks like right now for being able to keep positions open and operations in a regular stead. So please do, supervisors, remember to contact environmental health and safety if you have a ill employee. With that, I'd like to turn it over to Dr. Elizabeth Chilton. Again, as Kirk mentioned, she is both our provost for the WSU system as well as our inaugural chancellor for the Pullman campus. But I think Elizabeth will be wearing her provost hat for this section. I'd like to have her talk a little bit about what does in-person instruction look like for us this next semester.
Well, thank you, Phil. I really just want to reemphasize what we've been saying really since the beginning of this past summer, is that, really highlighting the importance of in-person instruction for our students. We did an excellent job, and our faculty and staff did an amazing job in supporting our students when we had to be primarily in a remote instructional mode. And really did an amazing job. But one of the things we learned nationally is that learning outcomes, students' sense of belonging, and all of the support services that we offer, there's an in-person element that's really critical. And so we have done everything we can this past fall to have a robust in-person experience at each one of our campuses, and it was enormously successful. We saw no transmission of COVID in the classrooms with our COVID protocols in place, which is masking required indoors. We, of course, had a vaccine requirement for faculty, staff, and students, and it worked, and we kept everyone quite safe. Now, there are some universities that have decided to either go online for the first week or two, or to start late. I saw some interesting data this morning in Inside Higher Ed that nationwide, about 90% of colleges and universities are welcoming students back to campus and are in person. And likewise, 98% of campuses across the nation are starting on time, are not starting late, because we have all learned how to keep our students and our faculty and staff safe. Of course, the University of Washington, many of you may know, did decide to go online for the first week or two. But it's important to remember that they are a semester school and we start at a later date. So we're actually resuming in-person classes on the same day as UW. And that helped us reassure us that we were in alignment with other public institutions in the state of Washington. We have been asking our faculty and staff to be understanding of students all along through this pandemic. And they have been, all of our faculty and staff, for those of you on the call today, I just want to appreciate your immense flexibility, your support of our students. We're all navigating this together. President Schultz has said many times in our COVID town halls, there's no playbook for this. And we are all working together to keep our faculty, staff, and students safe, but also provide them the high quality education that we're all here to support. So we are going to continue to be understanding of students. As Dr. Henry said, we are going to see some spikes in the early weeks of 2022. We're going to do everything we can to continue to support our students and have faculty help students figure out how to make up lost work if they need to make up lost work. And in a little bit, a couple of my colleagues will talk about how we can make sure we're supporting our faculty in this more flexible mode as we move forward. But we're committed to continuing to be in person, to continue to keep our safety protocols in place. And we've seen that that's really critically important for student learning, for student retention, and student success across our campuses.
Great. Thank you, Elizabeth. That was, I think, some important information you shared at the beginning. The fact that 90% of universities across the country are going to be in person and that 98% are starting on time. It's also, I think, worth noting, as you mentioned, that a lot of those universities that did decide to spend their first week online, those were the quarter system schools that actually are already in session. Many of those schools that are on a quarter system started on January 3rd. And we, being on a semester system, start January 10th. So as you noted, I think WSU and University of Washington and those other universities that made that choice, we're all going to be in person starting together on the same date. So thanks for that clarification. That was important.
Absolutely.
Great. Bill, it looks like your internet connectivity has been holding up, which is wonderful. Thank you. I'd love to have you talk a little bit about the instructional guidelines for this coming semester, if you could.
Absolutely, love to. Thank you, Phil, for the invite to come and talk to everybody about instructional guidelines. I think where I want to start today is I just want to take a step back and I want to recognize all of the hard work that went into fall 2021. We're in a very challenging time, and I just want to thank our instructors for all of the hard work and the energy that they put into making last semester a success. But I also want to thank that constellation of people who also help us with our students, and that is our advisors, our partners in student affairs, and in other areas of the university. Truly, an amazing effort was put forward, and the success that we saw last semester is something that we should note and be proud of as an organization. We're going to build on that foundation of success from the fall 2021 semester. What we know now, at least looking at data that we've got preliminarily from the Pullman campus, and we're doing a system level evaluation, is that student outcomes for the fall 2021 semester in terms of academic performance and their classroom performance really looks like pre-pandemic performance for students. We didn't see any large spikes in areas of concern that we all had. And so I think that really speaks to the effectiveness of what we put in place and what our instructors and others did to help our students. One thing I want to emphasize, and this goes back to something that Dr. Chilton just talked about, and that is really, as we move forward this semester, we're really going to need to think about keeping in place some of those flexibility efforts that we had for the fall 2021 semester. We're going to need them again, at least at the beginning of this spring, as we move into the next phase of whatever this pandemic is going to bring to us, and as we push through and persevere. As far as instructional guidelines go for the spring 2022 semester, I just want to remind some people, instructors, about a few things. First of all, we want to remind people that decisions about remote instruction, and by remote instruction, we mean things like video conference via Zoom or other platforms, hybrid courses, or online delivery. Those decisions really lie in the domain of instructors, but they really need to be made in consultation with the chair or director of their program or with their campus VC, vice chancellor. We recognize that these new types of delivery for some people can be positive modalities for dealing with student absences. They also can be good ways of dealing with reasonable accommodations that are needed for our students after consultation with the WSU Access Center on their campus. However, we also recognize that remote instruction brings with it a whole host of technical issues or pedagogical challenges to offering course delivery via video conference or by using Panopto lecture capture. So we highly encourage these to be in place if we can put them there, but we're not going to mandate them because we recognize that there are these external challenges. If instructors are going to teach remotely using either online, hybrid, or video conference technology, then we need to have them show up with formal training. That formal training is being offered through AOI or through the WSU Global Campus. And we need that to be in place so that we stay in compliance with guidelines that we're receiving from the Department of Education and from our regional accreditor, WCCU. Again, this is important because we've seen nationwide how important this training is to the positive outcomes that we want students to have when they learn using these modalities. The final thing that I have that I want to talk about is just real quick. I would ask that instructors review the guidance on video conference course coding that we put forward for the spring 2022 semester. I really want to thank my colleagues in the registrar's office and in other areas of the university who helped us develop these new course modality guidelines. We really needed this in place because we have to stay in compliance with the expectations of a lot of our external reporting authorities, including those not only at the state level, but also at the federal level. So as we transition into the spring semester and we start working with these, again, as a reminder, the registrar's office and others here in the provost's office are here to help you with that decision-making and helping to implement that in a practical and efficient way. So Phil, those were my comments.
Great, thank you, Bill, I appreciate it. Laura, I'd like to turn to you if we could and have you talk a little bit about the modified duty options for faculty for this spring semester. Laura, I think you're on mute.
Thank you, Phil. Thank you to everybody who's here for all your patience and all your work. Faculty modified duties are for faculty who may have a new family member, a new child at home, or who are primary caregivers for somebody who's ill or injured. It's a method of you work with your chair or your director to create a more flexible schedule to allow you to meet those responsibilities. Last year, we instituted modified duties specifically for COVID related issues, and we're reinstituting those this year. So if you have a dependent, a child or dependent parent who is sick and needs to isolate at home, or who's been exposed to COVID and needs to quarantine, then, or if your kid's school happens to be closed, which as we know has happened quite a bit, and you're responsible for at least 50% of that person's care, you may request up to 2 weeks of modified duties from your chair. That means you may be relieved of service. You may either have a colleague teach a course for you for those 2 weeks, or have to go remote if necessary. Those 2 weeks can be extended if needed. And what you'll need to do is discuss with your chair or director the nature of those modified duties, what they would look like. Complete a form, and the link should be in the chat. You can find it on HRS. Just type into Google WSU HRS COVID modified duties, and you'll come up with that. If you think this is going to be a possibility, knowing your situation, your life situation, please be proactive in planning. And chairs, I would encourage you also to be proactive in working on this with your faculty and thinking about ways to be as flexible as possible. And faculty also, you should have a communication plan in place to communicate with your students if you need to change things around or transfer to remote. And please have a look at that online form if you think you might need to use it. Be ready to act. If you yourself need to isolate or quarantine, that's a separate process in HRS, and I encourage you to look at that too. Again, thank you. I want to emphasize, and I'm totally amazed that we had no communication of COVID through classrooms last semester. I know people were really worried about it. I have a pregnant daughter. I'm really don't want to be passing it along either, or getting it from anybody. But I think we've done a really good job, and it's important to remember that. We're lucky that we have a mask requirement. We're lucky that we have a vaccine requirement. A lot of our colleagues in other universities don't have that. So I think we're about as safe as we can be under the circumstances. Thanks all and Happy New Year.
Thanks, Laura. So I'm looking at the chat, and there's a couple issues that people are asking about that I think are worth having us comment on. When Dr. Henry was talking about people getting vaccines, we shared a website called vaccines.gov. If you are in need of a vaccine or a booster, I encourage you to go to that website. Also, the Washington Department of Health has its own website for people who do need access to COVID-19 testing. I see in the chat here, a lot of people have some anxiety around availability of tests. I strongly encourage you to take a look at that website. I'd ask our chat moderators, if you can, please include a link to that Department of Health website. It's testing for COVID-19/testing location. So again, an opportunity for you simply to put in your location. It'll tell you where testing sites are available where you happen to reside. The other thing that we're seeing concern about is the weather. As we mentioned at the top of this discussion, right now, the state of Washington is experiencing quite a bit of issue around snow on the east side and a lot of rain and potential flooding on the west side. So I'd like to turn it over to Dr. Chilton, if I could, if you wouldn't mind talking a little bit about what this might mean for us in the way of classes starting on Monday.
Mm-hmm. Absolutely. Well, I want to say very clearly that safety absolutely comes first for our students, for our faculty, and for our staff. We've been encouraging all of our faculty and staff, and we will continue to encourage students on social media as well. And for those of you listening, that please monitor the safety of the roads carefully. And number one is your safety. If you need to delay your return because you're not able to get back safely, we are asking our faculty to be lenient in their attendance policies, as we are for COVID and illness as well. Not only are we dealing with a pandemic, but then you add bad weather events on top of it at the start of semester, and we are just going to need to be flexible. So if you're a student and you find that you're not able to make it back for the first day of classes on whichever campus you're on, please do contact your instructor and ask how you can make up the work. We will be as absolutely flexible as we can possibly be, and support each other. I did also want to mention, just your first point, Phil, about, people being anxious either about testing or vaccination or even availability of masks. That the governor did announce yesterday expansion of all three of those statewide, expanding testing, vaccination availability, and free masks across the state. And for those of you interested in more information, you can go to the governor's website, and there's a greater description there about expanding state resources.
Great, thank you. I actually hadn't heard about that governor's announcement. That's good to know. President Schultz, I want to turn it over to you before we wrap up to see if you might have any closing remarks you'd like to make.
Well, Phil, thank you. Just a couple things here as I look at my notes. I want to encourage everybody, once again, it's been Dr. Henry talked about this and others. If you are sick, please stay home. We want to continue to emphasize that. That's really, really important on all of our campus communities. Secondly, if you have not gotten your booster shot yet, please schedule to do that as quickly as practically possible. It's going to be important. Part of the reason for our success for the fall semester was our really high percentage of students, faculty, and staff who were vaccinated. We also want to see that same level of success for the spring semester, and those boosters are going to be important. The third thing, Dr. Henry also mentioned this, mask up. We do have a supply of masks, and we will be making them available across all of our campuses for those who say, well, I just got, I've got a gaiter that I've been using or something like that. We will be working to provide those, and we'll have more information out. Finally, I would like to say that I've asked each of our chancellors of each of our campuses to provide a written communication to their particular campus tomorrow with some of these things in there. It's no new information. It'll be web links. It'll be reiterating, but they'll be tailored to each particular campus, because some of the things that we're worried about their challenges in Pullman are not the same things that would be in Vancouver or the Tri-Cities and vice versa. So please expect not just this town hall today, but a written communication coming from those chancellors tomorrow in your inbox. And please read that, where we'll have the same sort of information for you. Finally, Phil may talk about this, but we're committed to doing these town halls periodically so that, you know, it may be the kind of thing after a couple of weeks or a month, we say, well, you know, it's the same stuff over and over again. We'd rather over communicate and make sure that people's questions are being answered, not, well, we're just going to assume since everything's going that everything will be fine. So we want to continue to be out there in front, answering questions, responding to concerns, and providing the most up-to-date information that we have. So I appreciate everybody joining us today. You know, stay safe. And let's have a great spring semester. I'm optimistic about it, although it doesn't feel very spring-like today. I'm looking forward to really a fantastic 2022 across the WSU system. So thank you.
Thank you, Kirk. I appreciate that. So that concludes the remarks that we were going to be making today. I want to thank everyone who's joined us online. Again, I know this was a day of difficult travel. Also want to thank our panelists. Appreciate all of you making yourselves available to share the plans for the spring semester. As I close, again, I just want to make a reminder, as we said at the very beginning of this conversation, if you will be traveling, particularly over the next several days, make a plan. Check the road conditions, check the weather conditions, check the past conditions. Make sure your vehicle is ready for winter travel. That includes making sure you've got blankets and food and water. And then also, again, I can't emphasize this enough, really allow yourselves plenty of extra time. This is not the year to say, I'm just going to run over the hill on Sunday evening and start classes on Monday. You really need to start thinking about today, what it's going to take if you have to travel from the west side, particularly to the east side. As we noted, as of this morning, all of those east-west passes were closed. I think the expectation is they will be opening, but even if they do open, travel will be challenging. So really, we ask you to be really, really careful. And as the provost mentioned, if you are not able to make it, contact your faculty members, let them know that you are not able to travel, and work with them to be able to make sure you can make up the work you might have missed. So with that, again, thank you for joining us. Please stay warm and dry, and we look forward to seeing everybody on campus on Monday. Thank you.